Scary as these times could be, our community has battled through a similar pandemic before. 1918, Spanish flu was responsible for 6,000 deaths in our state and possibly 100 million deaths worldwide. And here locally, there are some important lessons to be learned.
In the fall of 1918, Seattle was a boomtown. Industry was thriving, Boeing was just taking off, and soldiers began returning home from World War I. Executive Director of MOHI, Leonard Garfield.
Some soldiers got sick in Europe, and they came back to the United States, eventually to Seattle, and they brought with them a very virulent flu.
By September, cases began emerging in Seattle, and within weeks, the community was shocked to see thousands of cases. Seattle Mayor Ole Hansen took swift action.
So within a few days of the first illness, the mayor closed the schools, he closed the theaters, he prohibited people from any large public gatherings. He undertook the very steps that we see public health authorities taking today as we respond to the coronavirus.
Like we see today, many wore masks. One still hangs in the halls of MOHI today. Ironically, the 6-layered cotton likely did nothing to protect anyone. In November, a few months into the pandemic, Seattle thought it had beaten the virus, so Mayor Hansen lifted many restrictions, but the flu came roaring back.
There was an echo effect. There was a little bump of new cases that developed in December. The city became so concerned that it would repeat itself that it actually began to force quarantine on people who showed any signs of illness.
Tighter restrictions appeared to work, and by March, nearly 6 months after the first cases, Seattle was out of the woods. Garfield points out our response then and our response today are very similar, and lessons can be learned.
If we follow the lead of our public health authorities, if we invest in our public health infrastructure, we can actually tackle challenges like this. Because what we learned 100 years ago is that pandemics will come, and we know that there will be another one in our future.
And here we are today. In the end, the Spanish flu killed 1,500 people in Seattle alone. Another lesson learned after we thought we'd beaten Spanish flu in 1919, the following fall, there were fewer cases, but it came back then. So something to think about today. I want to show you one more example of lessons learned here when it comes to the Spanish flu. This is in Philadelphia back in 1918. When they found their first case, they did very little to add social distancing and those kinds of precautions. And look at how fast the number of cases rose. Compare that to St. Louis down below. Just a very short period of time between the first case and the very first time they enacted quarantines and social distancing. Look how flatter their curve became and how much more in control it was in that city. Another big lesson learned from 1918.